potential energy.
Right.
Okay, so it's bound into your system, but it's not useful at the moment, so it's potential energy. It's not kinetic. It's not energy in motion.
Yeah.
Okay? What's interesting is that you would think that you would go from this bound potential energy straight into, like, once it releases, then that's its kinetic component, right? But there's actually an in-between point, and the in-between point is called unbound potential energy. And so, like, now this potential energy, still not being used or expressed, has been released from the body.
Right, okay.
Yeah. For stage 1 of ascension is exploration. And that is exploring until you find bound potential energy. Then, once you find it, you expand it. That's stage 2 of ascension. And you unbind this potential energy into its now counterpart, unbound potential energy.
Yeah, right. Wow.
Third stage of ascension is the expression. Yeah? So, you now express this unbound energy. You release it into the system. Okay? It doesn't just leave the body. It actually becomes useful inside the system. Yeah?
Yeah.
And then you're able to use that energy to help yourself do it as whatever it is that you want to do. Whether it's heal, whether it's to win a tennis game, whether it's to play the sax, whatever it is, that's now available for you. Whether it's for you to grow or ascend, that's all becomes available.
Yeah.
So yeah, so you feel funny and laughter, so you unbind a little bit of humor. The universe has got lots of humor.
Yeah.
Remember that. The universe has lots of humor. Universe is always going, ha 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 ha, isn't this so funny? Just like considering my thumb, getting my thumb out of your glute here, ha 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 ha.
Yeah, it's enjoying this.
There's quite a bit going on in there. That's all right.
Yeah, I thought it was my lower back playing up at gym and stuff, and Geordie, my brother's helped me with some posture work, you know, bringing, because I was tending to arch this,
Yeah.
and so like bringing my kind of hips, I guess, forward,
Yes.
and then like shoulders kind of up and back, and like
Yes.
engaging lats,
Yeah.
which has been like pretty significant when like going to the gym and actually thinking about the muscles I'm engaging.
Oh, that's what I was showing him when he came in for his session.
Yeah, right.
Mm.
Yeah, well, he kind of passed it on to me as well.
He passed it on to you. Well, then we've done good in the world.
Yeah, we've done such good.
Yeah,
But,
that is awesome. Good.
Yeah, I thought it was my lower back the whole time, but it was really like in there.
In there.
Hard to find. And it's
Amazing.
maybe, I don't know, referred pain to there or whatever
Sure.
it might be.
Well, I can tell you where my thumb was. It wasn't exactly, the pain wasn't just there, was it? That was going down your whole leg into the hip. Yeah.
Yeah, 100%.
See, this one, you've got something on the inside line on both of these, but this one specifically, and through the groin on this left side. On this left side. What side was the torsion?
I think it was I want to say left, but I'm pretty sure the medical page said right. But I can't actually remember. I was like 10 years old. I can maybe find out my phone somewhere.
Don't worry about it. Doesn't matter.
But I'm not too sure.
Mm-hmm. Just got to decide what we're going to do here, because there's a few things that we can do. Turn your head to the right. Turn your head to the left. Well, we'll start at top, up at the top. Onto your back, face up. Just let the lower lip come away for a sec, thank you. And then it's a slow, easy breath through the lips and also out. Yeah. While we just get connected into your tissue here. That's it, there you go. Good, good, good. Good, you're gonna be flying today, I think. Through your jaw. Mouth breath, mouth, mouth. Yeah, that's it. So this is awesome to watch over here. So because what we've got to do is we've got to strip down some of the fascia that's inside in the neck. Because while you're breathing, while you're doing that, I'm holding those fascia lines. But yeah, you've got heaps of tension through these lines. There's enough tension in there, and it needs to sort of get cleared out, and it's almost like a little cleansing that needs to happen, and integration. So we'll start here with this. Just let your jaw relax. That's it, and then we'll just move through these bits here. Jaw, that's it, good. That's it right there. So different strings of your muscles that are attached in here, different fibers of your trapezius, your spinal neck extensors, jaw, loose, let it open, teeth away, that's it. I should get you to sort of help me here. Let's get to a point where you can connect in with me here. I can go here. So just bringing the bridge of your nose towards my thumb here. Yeah, and then the chin down and in. So now the rule is move towards, not away. Move towards, not away. You feel that? Yeah. So chin down and in. Now, this is what we call exploring, okay? So you're exploring to find the spot that you want to expand. So there we want to get into it, so dig into it, and then move your head a little bit and work with that. That's it, here we go. Tuck your chin into it, don't lose it. Yes, go a little slower. Yeah, so you can appreciate it a little bit. Chin down and in a little bit, plus I can guide you to the next position. Yeah. Yeah. Yeah, stretch it through the jaw and the face. Stretch your jaw as wide as possible. Wide, 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 wide. All the way through the whole face. Now, big mouth breath in. That's it. There you go. Whoop. So you see that connection deep in there? There it is. Yeah. There we go. Good. Now chin in, chin in. Now release the jaw a bit and just work that now. I'll help you. I'll support you here. There you go. I got you. I'll support you here. Oh, there you go. Oh, yeah, that's it. You feel the crunching there? And now we're in that one segment that was just fully jammed up. Just relax your jaw. Keep going chin down and in. Good. Take your time with it. There you go. That's it. It's going to switch to the other side now. Here it goes. Let's go off this side and just lay it out for a second. So I can change. You just had a switch. And hold on right there. There it is. Got it. Okay, go. Now you do it. Chin down and in a little bit. Don't disappear too far away from the depth of the spine in there. Chin down again. Yes. Yeah, there it goes through the face. Nice. Yeah. There we go. There it is. Good. There we are. That's it right there. There we are. How's that? You just out somewhere on another planet?
Yeah, I was like, oh, was.
Yeah, that's all right. That's all right. Yeah, there was heaps stuck in there in your lower cervical, huh? Deep pattern. You've got this upper cervical thing going on as well. I need start here. So when I get to this part here and we start to discharge it, just know that it takes time. So you've got to trust that the time will pass and just let it kind of radiate out of your face, okay? It just takes a bit of time. And let the jaw be a bit open. There you go, that's it. Good. That's it. Just give it its time, give it its time. Trust it, trust it, trust it. It's going. Just needs a little longer. It's close. It's close. There it goes. Good. Gotcha. Jaw. Stretch it for me. Stretch it wide. I know it's hard. Stretch, 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 stretch. There it goes. Good. That's it. Yeah. Nice work. Good. Come on. There we are. Hold on. Stretch your jaw open and tuck the chin down. That's it. There it is. Like an access point right there. There we are. Good. We're into some of that head trauma that you've had. Yeah, that's okay. It's okay. You're just moving through the pattern. Yeah. Here we go. I'm going to take you through an adjustment in a moment. Just working through this upper cervical pattern. Here it is. Here's an adjustment that'll happen. And it's still winding, so just let it follow. That's it. More adjustment. Okay. Just let that sit for a second, okay? So your upper cervicals, like the C1, C2 adjustment, the first and second bone, you just keep vibing. I'll just keep chatting. They're just heaps, such a strong and influential area of your spine that wraps around your brainstem. And so there was a bit of that brainstem tension occurring there, especially through the anterior aspect. So from the back of the throat forward to the brainstem, not the other way around. And so access to that was a bit challenging, but looks good. And we're just unwinding your cranials. Are just unwinding a little bit. Just the cranial jaw. Yeah. Yeah, here. There it is. Okay. We might have to do some cranials to you. They aren't very exciting to watch, but the light show on the inside is quite exciting. So just testing some of your cranial bones, because the bones of your face can move. So just moving them around just to see what's stuck and what's not stuck. There we go. That's all right. Okay, let's get you to flip over onto your stomach, face down. Well, this has changed your pelvis a lot. This needs an adjustment. This one's now jammed up.
How can you tell?
Well, I can feel it. I can see, like as soon as I pick up your foot, I can feel it. Plus, you know, this one wants to do this. Like, if it just left to its own accord, it would just be out there somewhere like this.
Like relaxed.
Yeah, like left to its own mind.
Yeah.
Meanwhile, this one does not want to do that. It just kind of wants to sit like sort of like that.
Yeah.
Yeah.
Yeah. Cool.
And so that pelvis needs to, this particular side of your ilium is what we call posterior inferior. It means it's rocked this way.
You're right.
Yeah, and it needs, I need to bring it back into position, but then it's got something to do through the adductors on this left side, maybe even on this right side. There's some stuff in there. We should probably clear that out as well.
Yeah.
What if we do that first, huh?
Yeah.
That'll be fun. Well, let's start with this left one, huh? Lay on your left side. Do you need any water or anything?
We'll do it for a minute.
Okay, great.
Thank you.
So maybe we can see what's happening from this edge here. So I'm going to go quite high up into the thigh, okay? I'm going to go right at the attachment of where this adductor magnus and the quadriceps and the hamstrings attach, all into the ischial tuberosity, okay? So I'm just going to come straight up. If you feel like you need to reach down and move the boys, be my guest. Okay, we can work with that. You just gotta let that discharge out the bottom of the foot. Yeah, that's it. There you go. Maybe from this way. So the sun. There we go. Ah, there we go, 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 there we go. So I like access into your leg from the side for the hamstring and for the adductor, which I find the more efficient with less trauma. So I'm going to do the hamstring as well, because there's stuff there. Here, there it is. Yeah, that's just discharging out the bottom of the foot and your heel. It's good. There you go, nice. That was it. There it is, good. That just went down quick, and it's moving fast through the hamstring. There it goes. Just moving super fast, brother. It's just going and going and going. I'm just gonna follow it out. There it goes. Wow. There we go. Okay, let's flip to the other side. lot happening in this one. Well, this adductor is not very functional, this one. That's okay. Keep going. There's a lot discharging from this one. That's it. There you go. That's next level. Yeah. Yeah, let that just flood your body. There you go. Come on. Let the channel at the bottom open, the bottom of the foot channel. That's it. There you go. That's it. See, it was just a little traffic backup. There it is. Gotcha. Yeah, heaps of traffic backed up. There you go. Come on, what else is this? What else? There's something else. Something else. Something else hanging on. What else is it? What else is hanging on? Okay. I won't say. There. That's it. I understand. I already got it, bro. There it is. Good. I got it. Good. Lengthen all the way out through the heel. There it goes. Now it's moving. There it goes. Good. Now the tension's moving through the hamstring. And just discharge. Let it discharge out through the back of the calf muscle and out the Achilles tendon and out the heel on this side. That's it. There it goes. There it goes. There you go. Woo! There it goes. More. Busy. This leg's busy. You know, we just have to wait. Like, tissue doesn't always respond as fast as we think it's going to respond. Sometimes we have to wait, and there's these down periods. Like now you're in a down period now because it's kind of finished its process, and now it's just sort of gone. Let's get through the calf muscle. There's a little bit left in here. There it goes. There you go. That's it. That's it. Okay, brother. Let's go face down. Let's take a look. Okay. Well, things are improving pretty rapidly now. Your pelvis is changing already. This side's changing. This side's happy to lay like that now. You see that?
Yeah.
Like it's okay.
Yeah.
Like I don't have to do anything with it.
Yeah.
It's okay with being there.
Yeah.
And this side doesn't want to sit out like that anymore. You notice that? It wants to sit like that.
Yeah, wow.
Yeah. So we've already seen a gentle restructuring just using your soft tissue and fascia, getting that structure to change.
Yeah.
There's still heaps more going on through this left side. We've got to do still more work. So
yeah.
Hang on. This is where I was earlier. Maybe come and grab it from this point of view here.
You know that like sort of intermittent hypoxia high you get in breath work?
Yeah, sure.
Like tingling, I've got that through my whole body right now.
Yeah, your whole body should be tingling. That's it,
Yeah.
brother. Yeah. Because breath work is breath work. This is full-on, full body work. Breath and body.
Yeah.
Bend your leg. Bend the knee. The knee. No. Where it was, just bring the foot to the ceiling.
All right. So
Yeah, sweet. Yeah, more simpler than the other ways.
Yeah.
And then just rotate around. That's about, there you go. Keep a little bit wider of a circle. There you go, good. There it is, got it. So as the greater trochanter is rolling back and forward, we are cross fiber releasing the tendons that attach to the outside of the big greater trochanter, which is that big giant bump on the outside of your leg. That's it. Yeah. There we go. Just there. That's it. Just there. That's enough. Okay. Well, you still, the misalignment hasn't really changed all that much. Turn your head this way. It's still the same type of misalignment you had earlier, face down, so that hasn't shifted. The only thing that's shifted is how it's affecting your body. So let's do an adjustment here. I'll have you laying with this side up, facing me, laying on your right shoulder if you're sleeping. Yeah. Bend this leg. That's great. And then here. That's great. And then here. That's good. Like that, and like that, and like that. That's it. Well. So we'll just work with my elbow moving through the greater trochanter again, but from the front a little bit. Before I was able to get that back end of it, but now we're just gonna sort of get through the front end just a hair. There we go. There we go. There we go. Just through the rest of this quad, we'll just follow that out. And so that's a level 2 fascia release. So we're just stroking through this vastus lateralis, yeah? Outside quadricep. There we go. Now we'll make that adjustment. Wow, big one. Okay, let's go face down. This is good. That integration, like I can feel your chin from up to down here. All right, this one's not. Okay, sure. And if you're, Elaine, we move your sacrum. You need to move your sacrum. And then possibly do the deep psoas. So your sacrum's rotated and dropped down on the left side. This joint was the one that was frozen this side. A bit frozen, but it was a bit jammed. And now what we need to do is we need to move this and then move this like this. So 1, 2, 3. That, yeah. Okay, so let's get you to lay facing me on your side. Good. Just from the back there, you'll see. Get close, we can get a. Make this adjustment on this SI joint right there. Right there. That's it. Good. Face down. This is significantly different, like how your pelvis is sitting on the table.
Yeah.
It's fully aligned at the moment. It's really good. Really good. Your glutes are back into shape. You've got normal leg lengths again. Both legs are sitting well. Good tension all the way through. Just gonna pop the fascia. You wanna listen? Just gonna grab. Oh, not much sound coming from you. This one. Still more here. That's it. Yeah, oh, that is good. So we have super flow through. We get to here, it gets a bit funny. There's a bit of confusion here like this. And then I get to here and it starts to even itself out again. Let's adjust that. There it is. It's a little higher than I thought. I thought it was going to be a bit lower. There might be a low one here. Bend your legs, both knees, feet to the ceiling. Peel your chin away from your chest. Slide it slowly. Bring your chin up. Keep coming, keep coming, keep coming. Right, a little bit higher. Right there. That's it. Stay there. Deep breath in. Exhale out. Come on. There it is. Gotcha. Okay. Drop down. Drop your legs. Just a bit more here still. Here. Something to the shoulder. Turn onto your back, face up.
Jesus.
You know, we're just moving some of the tension out of the shoulder unit because it is impacting your upper back, and I think it's mostly because of how your neck was. Yeah. That's it. There we go. Good. There we go. There we go. There we go. This line needs to be done. We'll do this one as well. There it is. Oh. That's it. This side's opposite, this side's the lat. Here you are, Janelle. So earlier when I started with you, there was a lot more stress and tension moving through your anterior rib cage here. This is a lot better. Feels pretty good, and your ribs have remobilized themselves, much more action, and your rib cage is wider. That's nice. Good. Good. And I like that bounce that we're getting from the rib cage as well.
Yeah.
It's so important, man. You were like sucked in here, and then you had very little mobility. As much as you were breathing, you didn't have a softness to it. It was just like this, like rigidness to it, and it was almost kind of pushing back against my effort in the beginning, and it was quite peaked here, so it came up. But now this is, I don't know, it's quite flat.
It's expansive.
Yeah, it just kind of comes out from the bottom, which is how the rib cage is supposed to be.
Right, yeah.
You need room for the diaphragm to drop down in there. You need room for the ribs to open up from the base, especially. You want heaps of base rib movement, and as it gets up higher into your rib cages, you can come and suck it down, but then once you start to expand, you want to really pull your ribs and let your ribs kind of open up, and they'll just like open up just like wings, you know? They'll just flare open, and that's what we want. That's nice. That's soft. That's good. Before, that was way too rigid, and you were holding way too much tension through, and that tension was coming all the way up to the upper part of your sternum, the manubrium up in here, this junction here. It was coming across your shoulder blades. It had your shoulders kind of pitched forward, but you had a whole myriad of like subluxations that were occurring in your neck and some patterning in there. This is better. Pelvis is better. Look, this is a really good stop point. This is a good space. A lot of what we dealt with today won't come back again. So there's some stuff that may repeat itself as a pattern, but for the majority of some of the patterns that we saw today, they won't repeat again unless you go back to doing what caused those patterns originally to repeat, like create themselves.
Yeah.
So if it's something from the way past that you haven't been done in a while that was just stuck in your body, it's gone. Like that's done. Yeah.
Awesome.
If it's a current pattern that you're involved in at the moment, and you're kind of repetitiously doing it, sort of like sitting at a computer for 8 hours a day, you're going to reintroduce that element of those patterns back into the system. So some of the stuff that we've gotten rid of today, that's enough. That's it. Some stuff will repeat. I reckon there's some stuff in your neck that's going to repeat. I think too, the pelvis and the sacrum, there's a little bit of repeat happening there. Although I got to tell you, the inside work on the legs and coming into the groin, you were telling us about when you were a child and having the torsion down there in your testes. And so, you know, if you think about that, how you say, there's a part of me that feels like I need to protect it, and then I notice that habit happening within my system. Do you know, like, solving it is part and parcel of recognition. So when you see that you have this apprehensive pattern in, a lot of people have apprehensive patterns for no reason other than the fact that somewhere in the past something happened that caused them to create a pattern. Example, if you have back pain, and so I actually found this for myself. I had back pain for such a long time. I had patterns around it. So every time I went to the dishwasher, I put my hand on the counter and put the dishes in the dishwasher. Then I get rid of the back pain, and then I'm loading the dishwasher, and I'm like, I put my hand there, and I'm like, hold on a second. I don't have any pain anymore. I can just go, whoo, whoo. I'm like, okay, there's no more pain. I can just squat up and down and load the dishwasher, and I'm happy. Right? But that pattern is still wired into your nervous system. So sometimes some of that is that. And I reckon that you probably like some of that down in the inside line of the legs, and then holding in your pelvis, I bet you is sort of related to that kind of stuff.
Even sitting like this right now, I feel like very relaxed, and normally I'd be straight into like cross my legs if I'm in this sort of position. So
yeah. I think there was some big pattern changes in terms of what has happened here. There was strong positions that your body was in, but now these seem really clear. And there's a very clear flow moving through both legs and through your pelvis, and now the mid part of your back as well, and then your neck. So I'll just do one more check, and then I think we're gonna call it a day. Okay.
Mhm.
Okay. Flip
Thanks,
around.
Rob.
Yeah, dude, I'm super happy with this. Really pumped. Okay, that's enough.
Beautiful. Thank you so much.
Yeah, that's all right. Give it a test drive and see how you feel.
Holy shit.
Yeah.
We actually like to just quickly download, feel it in your body. Yeah.
Oh, wow.
So there's no restrictions or nothing, man. Just go about doing life, have fun. We can talk about later on how to catch up with my work again.
Yeah.
And what other opportunities that there are to do, but yeah. Right now, super sweet.
My legs feel fresh. Thanks, man.
Thanks for working with me.
Legend. Thank you so much, John.
See y'all.
Cheers.